I'm particularly concerned about the number of cases in London, Kent, and Essex. Cases are rising and in many areas already high. Looking into the detail, the testing results and surveys show us that by far the fastest rise is amongst secondary school-aged children, 11 to 18 years old, while the rate amongst adults in London is broadly flat. But we know from experience that a sharp rise in cases in younger people can lead to a rise amongst more vulnerable age groups later. We've seen that happen before. So we need to do everything we can to stop the spread amongst school-age children in London right now. We must not wait until the review, which will take place on the 16th of December. We need to take targeted action immediately. Having spoken to the leaders of London's councils and to the mayor, we've decided to put in place an immediate plan for testing all secondary school-age children in the 7 worst affected boroughs of London, in parts of Essex that border London, and parts of Kent. We want to keep schools open because that's both right for education and right for public health. We're therefore surging mobile testing units, and we'll be working with schools and local authorities to encourage these children and their families to get tested over the coming days. More details will be set out tomorrow. I want to urge all those involved to step forward for the testing. It's important that 11 to 18-year-olds get tested in these boroughs, irrespective of whether they have symptoms. And this is a really important point, because we know that you can have COVID and you can still pass it on even without symptoms. Around 1 in 3 people with COVID have no symptoms at all, but they can still pass it on to others. And I know that nobody wants to be responsible for endangering those around them. So I urge everybody involved to get a test.